Hi everybody and welcome to today's webinar about talking mental health. I'm really pleased to be joined today by Chris O'Sullivan from the Mental Health Foundation, and I'll be handing over to him in a second to introduce himself and to get going with the webinar. But before we do, I'm just going to remind you, if you've joined our webinars before or if you're new to our webinars, about the ways you can participate. We've got two ways to participate. You can ask a question in the Ask a Question panel, which is underneath the main screen. If you post a question there, I'll ask Chris after he's finished his presentation, and we'll try to get to as many questions as possible. And you'll see there's also a chat panel on the right hand side of the screen. Please chat there and tell us a bit about yourself and where you're from and what your role is in the workplace. So I'm going to hand over to Chris, who will lead the webinar today. So over to you, Chris.
Thanks very much. It's a pleasure to be here. So we're going to be talking about mental health today, and obviously mental health is a subject that can be quite emotive, and we all have mental health, and it's something that sometimes is a challenge for us. So before we start, I just wanted to say that we will be talking about some of the triggers that cause mental health problems and some of the consequences of those, including around suicide. So if that's a concern for you, be aware. But we will be talking as well about self-care at the end. So the things that we're going to cover probably in brief today, because you could easily do a whole day's training on each one of these topics, but we're going to introduce mental health, talk a little bit about noticing distress and how you might reach out to somebody who you feel isn't coping. We're going to think a little bit about what you do as reps in terms of supporting disclosure and assisting people with ongoing concerns. And then we're going to finish with some bigger ticket things, thinking about how you might support strategic actions in the workplaces in which you operate, and what some of the ongoing and issues of the future might be for union reps and how that fits together. So I'm going to try and do all of that in 30 minutes or less. But please do jot down your questions and contribute, and occasionally I might ask you a question, and do feel free to share with us within the frame of what you feel comfortable with. So who are we? So I'm from Mental Health Foundation. We're a UK-wide mental health charity working to create a world with good mental health for all, and that means that we focus on prevention in mental health. So what is prevention in mental health? Prevention means doing more of what protects and promotes good mental health, whilst reducing the impact of factors that increase the risk of mental ill health or mental health problems. And prevention is the only feasible way to meet the huge mental health challenge that we face as a nation and as communities, workplaces and individuals. We need to find ways of reducing the impact of mental health problems for those of us who experience them, and I count myself amongst those. But we also need to address the risk factors for developing mental health problems and ensure that we can all thrive in safe and socially just environments. And that requires action at individual level for sure, but it also requires action at community level and as the nation as a whole. And it's important that we look to everyone, but we need to recognise that the most important work needs to happen where there is risk and where people are experiencing mental health problems, because they are the populations of greatest risk. So where does that fit with work? Well, good work can be a key factor in supporting and protecting our mental health. And I say good work because toxic work is corrosive to mental health and must be addressed. And for over a century now, the trade union movement has been about promoting good work and creating an environment where good work can flourish and where toxic work and toxic working conditions can be addressed. So in that regard, mental health is front and centre of the things that you do as a movement, whether or not it's explicitly relating to mental health or mental illness. And that's a very important message. Most of the things you do as reps have a locus or a connection to mental health. And you will often hear figures about the cost of mental illness, and I will talk about those a little bit. The costs are high. Direct costs can be up to 30 billion to the Exchequer, and indirect as many as 90 billion. But a couple of years ago we did a piece of research about the economic benefits added to the economy by those of us who are working with mental health problems, and we discovered that About 5 million UK workers with mental health problems contribute about £226 billion a year to the UK economy. That's 12.1% of GDP. So we need to stop seeing mental health purely as a problem or a burden or a collection of medically defined illnesses, and instead see it as an asset which everyone has and which can be protected and improved, and with the work of trade union reps safeguarded and developed in the workplaces who have union representation. So when we're thinking about some of the stats, because everyone likes stats in a mental health presentation, about 15% of working adults live with the symptoms of a mental health problem. That's 1 in 6. About 6,000 people a year in the UK die by suicide, and the population with the highest number of deaths by suicide is middle-aged men, but the population with the highest growth rate is young women. So there are some sobering statistics there. And whilst death by suicide can be one of the major consequences of untreated and unchecked mental health problems, it's also worth knowing that people with long-term mental health problems can die up to 21 years younger than people who don't have mental health problems because of a range of health inequalities and other factors. Only about half of people who experience mental health problems disclose those at work. And creating an environment where disclosure is possible is very much something that a trade union movement can be involved with. 300,000 people a year leave the UK workforce because of mental health problems. Sometimes that's unavoidable, but often it is avoidable because relationships break down and people can't communicate, another vital role that reps play. And these last two statistics are from our work on Mental Health Awareness Week 2 years ago, and we host Mental Health Awareness Week each year, and we looked at stress and the prevalence of stress and the causes of stress. 74% of people said that at some point in the last year they had felt stressed to the point of overwhelm or an inability to cope. And whilst 1 in figures are important, 1 in 4, 1 in 6, there are various figures around, it does sometimes allow us to other it and think that it's other people. 74% of people had been stressed to the point of overwhelm or inability to cope is almost everyone. It's 3/4 of people, and we all can recognise a time when that was the case for us. We also asked about the workplace, and 20%, only 20% you might say, said that powering through stress was expected as part of workplace culture. Only 7% said that their work treated psychological hazards as equal to physical hazards, despite the fact that health and safety legislation very clearly makes it plain that psychological hazards are on a par with things like personal protective equipment and workstation assessments, but we don't see it as such. So when we're thinking about distress and mental health problems, as I said, roughly 1 in 6 will experience the symptom of a common mental health problem, and though it can happen to anyone, some factors, things like inequality, poverty, existing health problems, can make it more likely, so it's not evenly distributed. And diagnosis is not the definitive way of understanding a person's experience, because one person can be very disabled by a so-called minor mental health problem like anxiety, where another person with bipolar can function very well with adjustments and ongoing treatment. So don't think through what a diagnosis means. Think through what an individual is saying about how that affects them and in their life. And we like to talk in workplaces about distress. And distress is not coping for whatever reason. Most of us experience it. And whether it's a mental health problem or distress, a compassionate response is key. Being able to be there for someone who opens up and talks about their mental health is critical, and you as trade union reps will be the recipients of those disclosures on a number of occasions. So how would you notice what would be going on? There are a number of flags that you might notice, and I'm going to summarise those and categorise those a little bit for you. And importantly, think of these in terms of how you might notice distress rather than trying to categorise them into particular mental health problems. So there are personal flags. Top line on flags is if a person doesn't seem to be themselves, and that's been going on for a little bit of time, or appears particularly, serious or acute, ask them, find out what's going on. Be a human being to another human being. That's the most important thing about connecting on mental health. But you might notice a change in behaviours and maybe appearance or manner which lasts for a few days, and it can be hard for us to recognise that someone's experiencing a mental health problem. People can hide it away. They might not even know, but if you see these things, start to wonder. And many of you will be looking at these and thinking, yeah, I recognise these. It could be tiredness, it could be minor ailments, it could be putting on weight or gaining or losing weight, it could be tearfulness, it could be negativity. It doesn't have to be the obvious things like low mood or anxiety, although it could be those things. There are also a number of work flags you might see, a noticeable change in work behaviour or performance which causes concern. Things like reduced productivity, so-called poor attitude, people working in different ways at different times, people increasingly with remote working and home working, hiding at home. Anything that looks unusual in the context of a person's working behaviour might have a connection to well-being and mental health, and it can be very important, particularly for managers, and you may see this as reps, to look through so-called bad behaviours or behaviours that are flagged up as somehow lacking in performance or capability, to see whether there might be a mental health reason, because we know from our research on disclosure that people often don't disclose a mental health problem until they absolutely have to. And in a work context, that can mean the point of being fired, the point of being disciplined, or because there's some major event happening. And we want to get to a situation where people can be open and authentic at work, no matter what their individual differences and what protected characteristics they bring. There are a range of things that can contribute to the development of mental health problems, and we can think broadly of risk of developing mental health problems being divided into three E's. Endowment, there's certainly a genetic component to many mental health problems, but also environment and experience are extremely important. So when we look at some of the triggers for mental health problems, they're many and varied, and as a result, there's no sort of this happens to you, therefore you will develop a mental health problem. But we can think about life events. Some of the ones you'll obviously know and come across a lot in the workplace, things like bereavement or loss, relationship difficulties, trauma, being exposed to things, whether that's occupationally, maybe in the rail industry, for example, or in the caring professions, or whether that's being caught up in a terrorist event or being in a car crash, something like that. Sudden health issues, but also the good things in life. And it can be easy to assume in the workplace that the good things are invariably good, but becoming a parent, buying a house, getting married, all of those can be major events in people's lives which can trigger either a new mental health problem or a recurrence of a previous one. And any ongoing challenges can be an issue. Obviously, change at work is at the top of that radar. Many workplaces are going through change processes or have change processes planned, and the nature of work as a whole is changing, and we need to look at that in relation to work. But many of these things are things that the union movement can help with anyway. Things like financial concerns, things like caring responsibilities and physical health problems, things like discrimination, things like having lived through abuse. Loneliness is a huge one. Loneliness has the same impact on our health as smoking a packet of cigarettes a day or obesity, but we don't necessarily realise that. And addictions and any approach, any time when you are the person who can receive a disclosure of distress, you may have people talking about these things, and it can be very helpful to refer both to union resources and also sometimes in a business where a business has employee assistance programs and other things which are designed and paid for to help people deal with these, but they don't always feel confident with. Generally, these things are more confidential than people think they are and can be very helpful for you to signpost to. So how are you going to reach out? Well, there's 3 P's here. Place and time are important. You need to pick a place that works for them, but also for you. And you need to pick a time when you have time to deal with the issue. It's not a drive-by thing that you deal with when you pass someone and check in with them. Make sure you've got the time. And if somebody comes to you and you don't have the time, set a time that's close by unless you're particularly concerned about them. Place-wise, it could be in the workplace. It could be a walk and talk. That can be very helpful if people don't want to make eye contact. It could be a drive, something that works for you and keeps you both grounded and safe. Preparation is important, particularly if you've got notice. Have a think about what you've noticed, what you've seen. Have a think about what resources you can bring. Make sure, for example, you always have the Samaritan's details in your phone so that you can instantly text it to people if they're worried, so you don't have to go looking around for things. And you might also have to be persistent. Sometimes people will say, no, I'm fine, when actually they're not fine. And we know from our research that a lot of people say fine when you ask them how they are. But if you come back and ask them again a while later, the first time you've asked has shocked them into thinking, well, maybe I could talk to this person. And it's the second, third, or even fourth time that a person feels safe to come forward. Now, having conversations about mental health can seem difficult or daunting, and they can be difficult or daunting. But we have conversations about all sorts of things all the time which are difficult and daunting. We've all had a conversation with someone about their marriage breaking down, or problem with their kids, or concerns about they may be caring for a parent with dementia. All of those are conversations which we think, oh, it's going to be hard, and then we do it and it's generally okay. And mental health conversations are no different. So some top tips for having these conversations. Presence is key, being present in the room. And we all know now, I'm just instinctively reaching for my phone to show it to you, but we all have a phone and it's invariably in our hands all the time. And that can be a real distraction if we're having a conversation with someone, because you don't want to fub someone when they're talking about their feelings. And the same thing can happen if you've got a laptop in front of you or a desk in front of you. It's a barrier that a person sees. So be present in the room, keep yourself focused on them, and don't allow any distractions. Open questioning is key when you're asking things, and you should ask questions. Open question is a question that doesn't invite a yes or no answer. So you could say, how are you feeling, rather than, are you feeling okay? Because it allows the conversation to open up. When you're asking questions, though, don't ask questions about things you don't need to know about. So if somebody discloses a mental health diagnosis, you don't need to know what the ins and outs of that are for them unless they want to tell you, or unless it relates to the work environment. Be aware of your non-verbal communication. Looking, giving eye contact to people, making sure that you're not guarded or showing irritation or things like that. Making sure that you're open and alert and able to talk to people. Be aware of yourself and what things come up for you. There are challenges that you will have in your life, and the way you respond to people and the biases you bring to that room can come into play. So be aware of that. And make sure that you follow up and do what you say you're going to do, because it's very, very important to people knowing that they've been heard, to see you act. And confidentiality is a key. You will all have your own frameworks for confidentiality, but there are times when you have a duty of care towards people with a mental health problem that you can't keep quiet about. So you need to be able to make sure that people know that they can trust you, but there are some circumstances in which you may have to seek advice or be open. Now, talking about suicide is one of the challenging aspects of conversations about mental health, and to be frank, it's the thing that people most fear. The same piece of research we did for Mental Health Awareness Week, when we looked at stress, we discovered that 32% of Brits who had been stressed in the last year said that they'd had suicidal thoughts or feelings in relation to that stress. And other research we did showed that 1 in 20 come to work whilst experiencing suicidal thoughts or feelings. So thoughts of suicide do not necessarily predict suicidal behaviour or completed suicide. And we talk about completed suicide or death by suicide rather than commit, because commit is a word linked to the old-fashioned world of crime. But the big message on suicide is that talking openly and directly about suicide helps prevent suicide. It doesn't make suicide more likely. So if you are worried, if your antennae are there, if you are concerned, ask a question. Ask someone, are you having thoughts of suicide? Or, that must be terrible. Some people in that position might have thoughts of suicide. And if they are, there are crisis signposts that you can use. The Samaritans is available 24/7. You can help them to call their doctor or a partner or a friend. But if you're concerned about someone's immediate safety, or they tell you that they plan to end their life imminently, call 999 and ask for the police, because they have the power to keep people safe, or take them to an A&E department. If you're worried that someone's a risk to themselves, or they're losing touch with reality, you have a duty of care in the workplace to see that they get help. Now, your ongoing support thing is usually about helping people to assert their rights, being present during dispute, disciplinary, competence procedures, and carrying out that duty of care. And there are a number of obligations you have around the Health and Safety at Work Act and towards disabled employees under the Equality Act, and you will have seen this in relation to other training and other roles that you have. I would say that the primary thing you can do is to be open to talk about mental health in an open and human way, and you will have training and strengths that you can bring from other fields of your work as a rep to this, and be confident to do that around things like reasonable adjustments. It's very important to look after your own mental health, though, to practice self-care, to know what works for you, and to know when you're full and when you can't do this job anymore, or you can't do it right now for a particular reason. So you need to plan time and space to maintain your own mental health. And you can use your own experiences if they're relevant, but don't make it all about you. You can be vulnerable, you can be authentic within boundaries. It's very important that you can debrief and get support. It's very important that you can acknowledge and learn from mistakes, because nobody gets this right the first time or even the fifth time. But most of us, whether we're reps or we work in mental health, are having mental health conversations on a daily basis. Give and receive feedback. Keep your comfort zone under review and read and translate those concepts to mental health. The union movement is rich with topics that transfer to mental health, whether it's health and safety, whether it's diversity and inclusion. But always make space for yourself, because you can't serve from an empty vessel. You know, if you've got nothing left to give to yourself, it's hard to be there for others, and that's an important message to go with. As I come to the end of the spoken part of this and invite the questions, which I'm sure are all stacking up here, just wanted to talk a little bit more about putting that together in a workplace context. So our work works on multiple tiers, from promoting good mental health for all, and recognising and addressing risks to mental health, to getting effective help when challenges arise and supporting people with ongoing mental health problems. And that translates in multiple ways to the workplace, whether that's enabling everyone to enjoy good mental health, whether that is addressing protected characteristics and other equality and diversity issues which can cause challenges in the workplace. We talk about resilience, but not just of the mindfulness and fruit skills kind of resilience. We were talking about personal resilience that's developed in the context of safe and inclusive work environments. And it's critically important that people feel able to come forward and people feel able to assert their Equality Act rights. And there are a few things to help you with this. The Thriving at Work report, which was 2017, that Paul Farmer and Dennis Stevenson did for the Prime Minister, is full of very useful information, very good business case activities, and these 6 core standards, which they feel, and I completely concur with them, could be done by any employer in the UK. So if you were to take this as a manifesto, along with the triangle of including everyone, you would have a good basis for starting to look at mental health in the workplace, and certainly it's something that the TUC and that we are keen to look more at. In terms of the future of work, it's a debate you will have, and we are a research-led organisation. Here are a range of work-related factors for common mental health problems. They will be very familiar to you when you're considering the nature of work and future work. Imbalanced job design, lack of value and respect, occupational uncertainty, job insecurity. And very interesting for the union movement, some terms that I hadn't really heard before until I read this review, which is an Australian review, around procedural justice and relational justice in the workplace. And those are 2 things that immediately speak to me as almost the core purpose of the union movement that you could take forward. And there's a lot of work in this area going forward. I'd really very much recommend the Minds at Work resource that Community Union did with Fabians recently as part of their work on the changing nature of work. It's a very interesting pamphlet which covers a range of territories if you're looking at making a strategic business case. But that's me for the spoken bit. I hope that's been useful, and I can see there are plenty of questions over here.
Yeah, that was really, really good. Thank you, Chris. I'm sure we'll all agree how useful that was. I'll get to some of the questions that have been sent in a second, but please do continue to post questions while Chris is answering some of the ones we've already had, because we've got time for quite a few. Before we get going with the questions, can we just also ask you that if people can share in the chat panel, if there's anything else that you would want from the TUC in relation to mental health and work. Is there any information that you think we could be giving you? Is there any training? Any other resources that you think would be helpful for you in your role as a rep from us? So please do post that, and we'll see what we can do.
Or any good practice that you've got in your own workplace that you want to share with other people.
Absolutely. Okay, we've had quite a few questions. Let's take a look. So the first one is from Steve. So Steve asks, should every workplace have a mental health or well-being member of staff? Is there any legislation to back up getting one?
Interesting question indeed. Every workplace has an obligation to look after the mental health and well-being of its workforce through the Health and Safety at Work Act. So we all have obligations in that regard, but employers have a duty to address psychological hazards. So you could use that as an argument. And increasingly there is a movement towards recognising mental health first aid as a concept and as a thing to be implemented. And it's interesting because the first aid regulations stipulate that employers have a duty to provide emergency help to people who are injured or become ill at work, and it doesn't say that doesn't include psychological injury or mental ill health, but it's almost tacitly assumed that it doesn't. So there is an aspect and an argument for saying that the same first aiders who look after our physical health should be equipped to look after our mental health. And certainly, having done public first aid duty, a lot of what you do as a physical health first aider is reassuring someone at a time when they are embarrassed, scared, and other things. So do I feel there should be a wellbeing champion in every organisation? I certainly do. And Paul Farmer and Dennis Stevenson were pretty clear that the way to achieve a holistic program of mental health in a business is to have board level champions, to have managers who walk the talk, to have first line supervisors trained and understand, and to have a social movement across the business. And when you sign up to things like the anti-stigma programs, and I would heartily recommend signing up for both Time to Change in England and Wales and See Me in Scotland, which we co-run with our colleagues at SAMH. Both of those anti-stigma programs create opportunities to grow and develop that kind of role within the business.
Okay, great, thanks. The next question has come from Jean. So Jean asks, do you think that retailers need to do more to support mental health in the workplace? Because as a union rep, I represent members who say they are too scared to tell their employer they have a mental health illness for fear of being treated unfairly because of it. Yes.
Excuse me, a cough to give me a chance to have a think. Yeah, I mean, I think there's a couple of points there. One on disclosure. That's what happens when you talk for 20 minutes straight in a very dry room. One on disclosure. I tend to advocate the sort of Green Cross code on disclosure. Stop, look and listen, and if it's safe to do so and you feel comfortable, go forward. We need to see environments where people can come forward with their mental health experiences and their mental health diversity. And to some extent, I very much admire the change which has happened both in relation to cancer in health terms and in relation to LGBT rights in terms of social justice, in terms of people being able to come forward at work into an environment where they have a reasonable expectation that will be treated with respect and dignity. In terms of a retail environment in particular, retail shares something in common with a number of areas of work where people are perhaps in either insecure employment or in job sectors where this stuff hasn't really happened at scale yet. And some of the vanguard companies, some of the people who've been doing great stuff for a number of years are in more professional or office environments, and we need to see how that translates. And there's some great work been done in construction and various other areas which sectors like retail could really learn from.
You okay?
Yes, I'm absolutely fine.
Okay. So next question has come from Joe. Joe asks, how is best to suggest to management to seek more training or be more sensitive about mental ill health?
An interesting point. If you look at the HR press and HR surveys, they'll all tell you that mental health is at the top of the radar for HRDs all over the place. It can sometimes be, though, a very difficult thing to prioritise, particularly in challenging business environments or tricky circumstances where other things are a higher priority for managers. What gets measured gets managed, though. So around measurement can be key. But personal stories can also be really interesting. And a lot of the time you see a business start to take action either because it responds to a tragedy or because it looks at data and wants to do something proactive around absence, or because somebody who is bold and brave comes forward and tells their story, and that story creates a resonance amongst employees and leadership, which enables that to go forward. And none of those are better than the other. I mean, you would obviously not want tragedies to happen, but sometimes people only learn when they are confronted by things. Telling stories is an interesting way, though, because whilst it can be extremely helpful, it can also be quite isolating for the person who's out there telling their stories. Sometimes having a broad discussion about what helps and hinders our mental health, whether that is long hours or difficult circumstances or caring responsibilities or depression, can be quite a good way of starting that conversation. And ultimately, sometimes it comes to a business case, and there are some very good business case stats. So Deloitte did a piece of work alongside the Farmer Stevenson report where they did a very detailed economic analysis sector by sector on the per head cost. And sometimes for a business it's as simple as looking at the cost not just of lost productivity, but also the cost of replacement, re-recruitment on an ongoing basis.
That's great. We've had another question from the same Joe saying, what can us reps do to better support each other? Sorry, that's just disappeared. What can us reps do to better support each other or seek support when we feel overwhelmed? Yeah,
great question. There are things that come across your desks as, or not desks, because I've just said don't put a desk in front of you, as reps, which are certainly upsetting. And when there's more than one rep in a circumstance, you can be a very strong peer network for each other, where that confidentiality can be maintained and where you can be certain that your reps will be there. So you can do debriefs with each other, you can meet and discuss things, you can look at issues arising around mental health and work together about how you're going to bring those to management or leadership. Ultimately, you need support, though, and there are likely to be things that are available to you centrally through your unions, and there's resources that TUC have. But ultimately, you can also use services like Samaritans and other helplines to explore your role as well and how you feel about it. And don't feel shy about doing that, and don't feel shy about not being able to do the important work you do as a rep when you've got stuff going on, whether it's your kids are doing their GCSEs, your mum's had a fall, or work is busy for you. You cannot do this 24/7, 365 days a year unless you're a full-time officer, in which case you can, but not 365 days.
Good point there. We've got a couple more questions have come in. We've had one from Christian who asks, are you working with Universities UK around their step change work?
Mental Health Foundation specifically, we've had some contact with Universities UK, but we are doing a programme of work on universities and students, and it's something that is a particular interest of mine. I was a full-time officer once. I was a NUS Disabled Students Officer, and the union, the importance of student mental health cannot be underestimated. Neither, though, can the importance of young workers' mental health and young workers who've not been to university. So we are translating some of the work we've been doing in schools into transitions from FE into universities, and looking at university mental health is really important. But we would love to see a greater focus on young workers' mental health, and particularly the mental health of workers aged 16 to 24, who we know are the population with the highest incidence of mental health problems and also the most willingness to talk about it and to take on stigma and address things.
We've had a couple of questions about mental health first aiders and first aider courses. Sure. One of them is about the TUC's particular policy on this, about mental health first aiders. We do have information on this, but it's something that what we'll do is we'll post a link to it in the chat section, and we will make sure we post a link to when we have the recording of this webinar available, because there's several bits of information about that from the TUC's perspective. But I will also ask Chris what your perspective on mental health first aiders in the workplace.
Sure. I was a long time ago involved with bringing mental health first aid from Australia and into Scotland. And as a skills-based course which allows people to recognise and provide emergency support, it's a good idea, and it's been very popular. It certainly has a place in any consideration of an approach to mental health. But I think a colleague in the construction industry said to me one day, I have first aiders who can stabilise a fracture if a guy falls off the building until an ambulance comes, but that doesn't absolve me from the duty to stop falls from happening in the first place. So I would say that mental health first aid is definitely part of the picture. We definitely need more people to be able to respond to people in acute distress. But when a business decides that mental health first aid is the only solution and doesn't look at how it leads and promotes leadership for better mental health, or address the nature of the workplace as a whole, or the wider needs of people with mental health problems as a diversity group, then there's a challenge, because mental health first aid is very prominent and is only part of the picture.
I think that's all of the questions we've had for now, because there's been a few repeats of questions. And as I said, we will make information available about mental health first aiders in the resources section of the webinar. We've also had a few questions about if there's a recording available. Absolutely, we post a recording of this on YouTube at the latest tomorrow morning, but more likely later today. And if you signed up to this webinar, and obviously all of you who are watching it did, you'll get an email from us tomorrow with a link to the recording in that, and all the resources will be also posted there. Yeah. So don't worry, if you want to watch it again, it's going to be available. I'll just, before I just pass back to Chris for a minute to sum up, we're really keen to hear what you think of these webinars, and we really like your feedback. So if you could add in the chat window any thoughts you've got about how the webinar was, what you found useful, what you want more of, if there's anything you didn't find particularly useful, please leave it there, and we do take everything on board, and we just want to improve our webinar service to you. So okay, before I wrap up, any final words? I'm
just looking over at the chat window and seeing what's coming out. There's a couple of really good points there coming up. One is about IAPT. So IAPT is improving access to psychological therapies. It's available in England and Wales, and it's very useful because it enables people with so-called mild and moderate mental health problems to be able to access support very quickly, often on a self-referral basis. So what I was saying earlier on about having resources available, know what's available locally for you. So know what the crisis service looks like, and whether it's a social work response or an A&E response, but also know what's available through IAPT. So many IAPT services have things like mindfulness-based cognitive therapy, or ECBT for insomnia, really useful things that are free and available for people in different areas. The other question which came up was in relation to union reps being ideal people to be mental health first aiders, and this came up at event I was at, a really excellent event on the nature of future work and its risk for mental health problems that STUC ran as a day school last week, and it's maybe something that TUC might want to consider doing as well, about the position of union reps as in this role. Now, we hear a lot of companies and businesses and organisations who have a defined role, whether that's mental health first aider, whether that's mental health champion, whether that's mental health ally, and they all mean different things in different businesses. We would say that having a group of people who advocate for mental health in the context of a business environment or a work environment is very important, but the roles are somewhat different. You can have someone who leads on campaigning. You can do that, and we've all met people who like to do that, and as reps, you're certainly good at that. And there is a role for listening and helping people to interpret what they're going through. There is a role for signposting people, and there is a role for speaking out about your personal story. And what's the right blend for any given workplace is up to that workplace. But what is clear to me is that a good union rep fulfills a lot of those functions on a regular basis. And if I were advising a business, I would say that their union reps could be a huge resource for them in any of those roles, according to capacity and priority.
Thanks very much, Chris. I can see all the really lovely feedback coming in. Thank you very much, everyone. Just another quick word about this webinar and about all the stories and information you've been sharing in the chat panel. That this information, we don't take it down, we don't delete it or anything. So as you've signed up for this webinar, you will be able to return here anytime if you like and check out any of the other comments or stories that have been shared in the chat. So just in case you haven't been able to keep up with them all, because I'm aware it's moving quite quickly in the chat panel, don't worry, you can come back and look later. So just before we wrap up, the TUC, as well as wanting to improve our webinar service, we're looking at how we can improve our support for reps in many areas at the moment. So we want to hear from you about your roles and how we can better change our service to you to make you better reps. We've got a series of focus groups across the UK. You should be able to see on the slide that's up at the moment. Cardiff, June 20th, London, June 24th, Manchester, June 27th and 28th, and Birmingham, July 1st and 2nd, Glasgow, July 8th and 9th. You can sign up to take part in these focus groups, and the link is on the screen. It's www.tuc.org.uk/focus groups. Also, we will be emailing out a survey about the TUC support for reps and services to reps. So do keep a lookout for that in your inboxes. And of course, to hear more about our survey and any future webinars, do keep your eye on our website on tuceducation.org.uk, where we advertise all training for reps. So that just leaves me to thank Chris again, and thank you all for tuning in. See you again.
Pleasure.